Right now, let's turn our attention on the latest thing we should be worried about. There's been some talk from some world leaders about a return of COVID. We've also got monkeypox, but we're not allowed to call it monkeypox anymore because now it's called Mpox, because apparently it was racist to talk about it being monkeypox. I never worked out why either. But across large swathes of Africa, we are told now by the World Health Organization we have a health emergency. Well, let's talk about this with Dr. Chris Smith. He's a consultant virologist at the University of Cambridge. Good afternoon to you, Chris.
Hello.
Thank you very much indeed for joining us. I have to say, when I've looked online about the announcement of the World Health Organization that this is a global emergency, an awful lot of people are just going, sod off, not willing to pay attention to the World Health Organization. We don't trust you anymore after your handling of the World Health of the COVID crisis. Is there a global health emergency with Mpox?
Well, it started about 2 years ago that Mpox or monkeypox began to go on the move. And in 2022, we saw one form of it emerge with a big international outbreak that was chiefly centred on men having sex with men. And it caused tens of thousands of cases around the world. And it kind of mobilised us and galvanised us into realising this isn't just a problem for remote geographies in Africa. This can spread quite quickly.
Yeah.
Now, the WHO then said, well, we think we've got that under control, and they declared an end to that outbreak last year. But bubbling up underneath was another outbreak of a slightly different variant of monkeypox. This is called another clade or clade 1b monkeypox or Mpox. And that is centred on Central Africa, the Democratic Republic of Congo. And it has emerged very quickly. And we've seen tens of thousands of cases now this year centred on Democratic Republic of Congo, but now also spreading to other centres in that country and to adjacent geographies, Burundi, Rwanda, Kenya, Uganda.
Yeah. And in
that
terms
is
of
why they're concerned.
That's their concern. And a lot of people are likening it to the early days of HIV, and where HIV was sort of written off as something that was happening over there in Africa, but also when it did spread to the West, it was happening only to gay men, and people didn't care about gay men. And that was the argument that was given at the time. Now, when we were reporting on monkeypox, as we were allowed to call it last year, again, it wasn't just that this was happening to people, to men having let's be honest, men having anal sex. That's what it was about at the time. We were told at the time. It was actually about orgies. Basically, this was really being spread at big gay orgies, and basically, unless you were at gay orgies, you were unlikely to catch this. And so a lot of people went, frankly, why are we having to be bothered about this? Because the vast majority of people, including, by the way, most gay people, are not doing that. So what's changed?
The difference is that there are different forms of Mpox. And there's a form which is centred on, in terms of its origin, West Africa, which was the origin of this form that was spreading amongst gay men.
Yeah.
But this new outbreak is another form, the Central African form. It's called clade 1b, and this is not spreading sexually. A lot of the cases are among children, and the mortality rate and the severity of the disease is more intense. It's maybe 10 times higher. So clearly there is another mode of transmission, probably akin to what we've seen before, where you have contact with an infected person, you might have aerosol transmission, you breathe it in from people who have infectious skin lesions.
Yeah.
This means it's a much greater threat, because it's not just going to affect a group where you can identify who may have been exposed and then intervene with vaccines in order to stop the transmission chain. It's much harder when you have communities, often poor communities, very overpopulated areas.
Yeah.
People also being displaced by conflict, because there have been conflicts in the Democratic Republic of Congo, which is displacing people. And when you put all those ingredients together, very high population density, population displacement, and poor circumstances where you can do poor intervention, poor surveillance, and population mobility, people leaving those countries and going internationally, you've got all the recipe for causing outbreaks. And we've seen how, with the example we saw 2 years ago, it can spread albeit among a limited group of people in that circumstance, but this is different. If it goes beyond the shores of Africa, then we may have an international problem. That is why the WHO
and it's about it mutating and changing. We saw, of course, COVID, very, very different kind of disease, but with COVID, where, you know, it was much more spreadable when it became the Omicron variant, and then was, you know, so many people didn't get it before then. But it, of course, we were, you know, lucky, but although it's more normal, it had actually become less virulent. I've read that in some of these African countries we're looking at a death rate of 10%, which is extraordinarily high. Is that likely, though, if that is the case, that it's because actually very poor, very unhealthy people unable to access decent healthcare are getting it, whereas in the West, for instance, it wouldn't see that sort of death rate?
To an extent, that's one of the things that people have said, that if you have diseases in deprived circumstances, they're going to be far more intense and far worse. That said, the other form of monkeypox, which is in West Africa, doesn't have the same degree of disease intensity or mortality, but is hitting many of the same people in the same sorts of circumstances. So that would argue that it's not just a deprivation problem. Also, we saw when the disease was translated into people in the West, that there wasn't quite the same level of mortality, but there were still deaths. And so it can still be a serious disease, and we need to take it seriously, which is why the WHO is
Do you understand, though, why a lot of people are incredibly wary of trusting the World Health Organization and things, when they changed so much their advice during the pandemic? They have been proved themselves to be incredibly untrustworthy in quite a lot of things. And when we're constantly told, there's might be another pandemic, an awful lot of people just say, no, I'm not listening anymore. And that's where this terrible breakdown of trust between people and people we should be able to trust, looking after the health of everyone in the world, you know, I'm brought up by a GP. I used to trust scientists and medics when they told me things. I'm not a conspiracy theorist. You know, I don't believe COVID was invented or any nonsense like that. But I don't trust the authorities when they tell me these things anymore. That's bad. That's a very bad situation for the authorities to have created for themselves with the misinformation they have put out over the last few years. Do you accept that?
One of the criticisms that has been levelled not just at the World Health Organization but at governments internationally was we were way too slow off the mark, not just with the COVID pandemic, but with others that have come beforehand. Swine flu in 2009, for example. And so given that sensitivity, I think people are now making sure that there is no reason not to be agile in our responses, because we have a better prospect of curtailing an outbreak if we warn people and if we warn countries this may be coming, put in place various measures. Because what this declaration means, it's not declaring a pandemic, it is declaring a state of emergency that makes countries put in place various measures that hopefully will prevent the pandemic.
We shall see. We shall see.
Some advice will be issued, including things like better surveillance, pulling up your vaccine availability, stockpiling drugs that may work against this, for example. So that's the kind of measures that this tells countries you have to step up and do.
Dr. Chris Smith, so appreciate you joining us. He's a consultant virologist at Cambridge University. Philip Ingram, I mean, this is the terrible things, though. A lot of people, and I think quite understandably, don't trust. I mean, I'm not anti-vaxxer. I'm not. I get tapped by both sides on this debate. But I just think, you know, from you know, our medical establishment here, science establishment here, the World Health Organization, Fauci and everybody in America, I mean, all the stuff that has come out that we do know about has just shown they just repeatedly just made stuff up and then told us it was, quote, the science. And I don't think people trust them anymore. And people might lose lives because they don't trust them anymore. And it's not because we're idiots, it's because we know we were lied to last time.
Yeah, and this is the trouble with not getting the proper lessons out of how we dealt with COVID. It's easy to find the mistakes with 2020 hindsight. When you're trying to predict what's going on in a situation where you don't know what this is you're dealing with, that's where the real issue is. And that's mistrust is being exploited, and it's still number one and I'm going to quote the World Health Organization again, but still number one in the World Health Organization's concerns as to what's going to affect human race. It's disease X. It's disease X because it's a disease they don't know. I think you'll
find that they believe the number one challenge is now climate change.
Well, we'll not talk that, because that's going down.
They don't even do the job. But anyway, I also don't want the World Health Organization deciding what happens in my country ever. I think I may not have voted for a particular government, but they're democratically elected in our government. At least we have a say over it.